entrepreneurs. I request Dr. Magirwal sir to kindly act as a chairman. I welcome him on behalf of ESCON and ACBM. I would request Dr. Verma sir to kindly act as a co-chairman. I welcome him. Thank you, sir. Join. On behalf of ACBM and ESCON. I request ma'am, Dr. Umrikar, to kindly act as a co-chairman for this session. I welcome her.
Paper presenter, Mr. Uday Umrikar, sir.
Good morning, everybody. मेरी आवाज तो सब तक पहुंची होगी। Today, I am presenting this great paper with the interest to pass on certain message, a kind of awareness, and hope for entrepreneurs in the field of veterinary genetics or animal genetics. एक बात ऐसी है कि जनरली हम समझते हैं कि एनिमल जेनेटिक्स ब्रीडिंग जो है वो एक इट इज अ एनिमल हस्बेंड्री सब्जेक्ट. इट इज नॉट अ वेटरनरी साइंस, समथिंग वी हैव बिकॉज सिंस लॉन्ग वी आर मोर इंटरेस्टेड विद द ब्रीडिंग पार्ट, और जो क्लिनिकल एप्लीकेशन जो ह्यूमन में होता है तो हमने एनिमल में बहुत कम ध्यान दिया थ्रू आउट द वर्ल्ड. काम तो हो रहा है. So myself, Dr. Uday Umrikar, I did my postdoctoral training in Switzerland, and I have my most of the service happened in the Bombay Veterinary College at the head of the department. Then I moved to Ethiopia and then Rahul Deshmukh is my student is there, and Dr. Rahul Deshmukh is my student, MBA student, and he has established a company. Yesterday he got the award. So, Promo Expert, and it is the first such company where he is giving the genetics testing services to the field. हमारे breeding goods जो होते हैं उनको analyze जो actively काम करता है. So same thing he is doing privately, but he has his freedom to go into pet also, pet genetics also, dogs farming. So he is having his freedom to give services, even bird sexing whatever. Okay. So this is just I will introduce this company Prof Expert, and he is giving some kind of services where parentage verification in the website. Okay, he can do that testing. Then he can give the ever give diabetes. Somebody wants even give privately. So he is though he is having a good job also, but he is more inclined toward going now completely getting involved with that. Dr. Ajay Sharma also, when he visited our lab, we have a service in genetics lab in Bombay Veterinary College, 2.2 crores establishment to Ajay lab. And he visited, and at that time he was appreciated. Dr. Rahul Deshmukh at he has done this kind of private. So he is giving that bird sexing also, and he is instead of asking job, he is creating job. That's an example for our young generations who are studying so hard in genetics. Getting PhD in genetics is not so easy thing. Everybody has to work a tough thing. But after getting 45 or 40,000 salary, is a bit he just said what to do. This is competition. But there is, if you have kind of dream, they can make they can employ people. So actually we have thinking that there was bird defects center lab. It's like a story also, success story also kind of thing. You can see that. So Mr. Prima Purandar is the women geneticists in Bombay lab, bird defect center in Bombay in the Bandra. And she is doing good service, giving good service throughout India. She is very famous. I came across in Madras. health, SRL, net genome, and diagnostic. All these are giving the services in the now even in Bangalore and all, I saw that complete our genetic screening can happen and they can find out what can be the possibilities. Okay, and many other private small labs are also there throughout the India. And so impact of genetic disease in human, substantial impact is there. You know that 8% of the individuals under 25 years are diagnosed with genetic condition. Or 30% children are also having the defects. So then they have a way of testing newborn, diagnostic testing, carrier, they screen for carriers, and parental testing, parentage also. We can see that in the disputed parentage and all. Then type of genetic test in human, forensic testing, research testing, pre-implantation genetic testing. So I am just trying to complete in 20 minutes. No? That's I'm not stressing much on that. So beneficiaries are, if we see our livestock industry, no? So this is Rahul's to get established in the area. This is Rahul's promo expert thing. Beneficiaries are animal breeders, biologists, veterinarian, and medical biological professionals. Promo expert. His company's mission to help clinicians, animal breeders, and all. The vision is to get established in this area of genetic research and diagnostics. Services including karyotypic services, and then molecular genetic services. The karyotyping molecular techniques is using. Then molecular genetics is identifying the defects, which are whatever defects they are passing through the bulls through AI and giving a huge economic loss, which we don't know many times. Externally we can't know, but if they pass on so much of loss, so he is also involved in that. And so canine also is working DNA-based tests in different animal species. Then pathology is also doing work in pathology also, human genetics. Then our domestic animals in India, we are what is our motto is that genetic improvement. We say genetic improvement. Okay. So what we improvement, why we want to improve production and conservation is, and we also want those some breeds are not producing, but we want those breeds to preserve, isn't it? Tomorrow we can select, like yesterday Dr. Patil was vice chancellor was telling that we are killer breed also can be exploited. So we can, but before that we have to conserve. So conservation also, then fertility should be good, and then fertility should be good. So we have to keep them genetically clean. So clinical genetics applications are and applications in pet practice to be also attended. So present stage what we are doing in India, last year global mission around 2,400 crores rupees are allocated to that during the 5 years period. So what is focus? Our focus is AI was initially, but now we are focusing on IVF technology, and we are building all that infrastructure. So promoting, what is our interest is promoting indigenous cattle and buffalo rearing and conservation. This is the global mission objective. The present constraint, what are constraints up now? Unavailability, they said, if you see the research report, they said that there is unavailability. Bulls of this high quality breedable heifers are not available. So they have to find out and multiplication for their breed multiplication farms and then bull mother farm. And genomic selection, when you want to do genomic selection also in practicing the NDDD collaboration with bio and all. So they also have a breedable number of individuals. Why breedable population is less? Fertility is why it is less? That is the question. Because sperm and oocyte genetics need to be evaluated for better future. So we should not forget the sperm and oocyte. Now we are using for the 5 years. So now we see that progeny tested sires, when we get a sire progeny, first thing getting progeny tested sire is not an easy thing. When we get it, we think that it's okay. No, but because no, it is known throughout the world that even progeny tested sires are also having the defects, unnoticed defects inside. If they are not being tested, just we are neglecting 100 rupees or 1,000, 2,000 rupees test, and we are using that. And then not good because the calving uterus is large. That we are not doing. When we purchase cow, buffalo, even now we don't have records of we go and purchase, isn't it? So we see the milking. Milking is good. When we will see more than what normal, but it is keeping, it is resting for reproduction long because fertility is not happening. And then we are not, when we select animals, we are not seeing the reproductive performance. So that's why we are selecting the bull based on the first lactation. We think that a good lactation, doctors are good, so select that bull. That mistake happens. So that is just the thing is that what awareness already is there, government is strict, central monitoring its norms are there, sperm banks are already given instruction, and accordingly grades they get. So still awareness is not there, and we are getting the problem. Now just to demonstrate, see, suppose this is the population 100 animals and 2 males and 1 female. Okay. So just we are not we are breeders, we are selecting. Okay. If we are not interfering, the 3% defect will remain in the population as it is. Okay, natural selection. God doesn't want this defect to increase. But considering we are we go for natural selection, isn't it? Because all breeds we are not going for AI. We go for natural selection, and in that, suppose that bull is having defect unnoticed, and we find that the 3% is increased more. And some because in generally water conservation, what breeds we have now, then we are using this natural selection mostly. And then if we go for AI, and suppose we did mistake here, we find so 50% of animals are getting. So like getting defective. And because of that, this fertility is getting reduced. So, but our population is very large. So getting spreaded throughout the population will take time. But when it happens, then it is not in our control. So government has made a strict. It is strict to analyze all these bulls. But still, we have to be also having that awareness develop inside us. So key problems, generally key problems what we see, repeat breeding. We always come across the repeat breeding. Okay, and repeat breeding means what we see that there are different causes, nutritional. Generally you see that you good nutrition when repeat breeding, isn't it? Hormonal bad management, but we don't think that we should go test that animal for the genetic defect. Because we say, how many genetic defects we get in the population? Very less, 1 to 3%, isn't it? So then what do you worry? But see that 1 to 3%, one bull might be there, so it has transmitted, isn't it? So bull who is selecting good win. So that's why the genetic causes are important. And then blood, and see that because of this Sweden now you find that in Sweden losses of 2 million Swedish kronor per year happened. In India, it was technically estimated that a bull, suppose defective bull is used. We have found, after use also we found bull. In civil station already used in AI, and then we found that it is defective. And then 1.5, one defective bull will bring 1.5 crores rupees more than that losses per year. So how much losses they might be producing? So like with blood is the chromosomal level defect, blood is the genetic level. So genetic level defect will also in US you find $5 million losses in we are seeing. So that's why we are all serious about this thing. So what happens? How fertility gets reduced? Production of unbalanced gametes. Then zygote dies at early stage and we get to reduce fertility. So this is something defect. Just one defect is like generally these chromosomes are separate, but they get united. Same thing will happen in become defect. And then unbalanced gametes will happen. You find that these are unbalanced gametes will happen. And this unbalanced gamete produces the unbalanced embryos, and then embryonic mortality is there. Then we find that conception rate is getting less. And so in Maharashtra, the number of cattle is a very less number. Okay. And there are bull mother farm. We found that one bull is now has the bull used for bull mother farm when was dangerous nowadays, isn't it? So in Maharashtra, Gaurav cattle farm is there in Vidarbha. Okay. So there we found that the main bull used for producing bulls for distribution was having defect, and that defect was this. Generally, X chromosome is like this. This is the very sophisticated diagnostic technique, fish technique, fluorescent in situ hybrid. Okay. And we have centromeres are centromeric probes we use. And see here, centromeric probe is not the X chromosome. And this is also, if we are not using this is also considered X chromosome. No, it is not X chromosome. It is the abnormal chromosome. This is the Y chromosome. Here also we might not find the centromeric heterochromosome. Okay. So we can diagnose like this through genetics, and then we have found that we have to stop that farm completely. Bull mother farm, we have stopped. So there are advanced techniques where you find the different pairs of the chromosomes, the spectral karyotyping. They get different colors. So advancements are there. We need to use it. That's why this veterinary genetics is also used in clinical genetics. Okay. So global awareness. You find that globally you find that in France, more work is going on in this. So many labs are there. Okay. And otherwise throughout the world also the things are going on. Europe is more concentrating. Okay. And throughout the world you find the reduction in the fertility. Just I have given the reference to make other that throughout the world you find this. So India cannot be escaped. So simple way, what is bull mother farms are, special ET centers, farmers should be tested. And NDT is providing the services. And there also one student is in charge of NDT genetics lab. And he is doing national level, he is contributing, and this student is contributing at private level. So all bull mothers, bull for progeny testing, ET centers are screened for that. Culling happens with the abnormal, and then find the population and is the genetically linked. So veterinary genetics has different parental genetic disorder, parental verification genetic disorder, karyotyping, A1A2 testing, like different tests are there. Parental verification, this way find that whether the offspring is of that parent or not, because in animals also, bulls progeny also sometimes get unnoticed. So in genomics also, we know genomic selection. There are also the G, Saiva, Prof, Murrah, and Mehsana, all work is going with the NDT. Then sex event sorting, all these tests are related. Now in dogs also we find we need to do testing, and dogs we are not interested economically, but since we are also veterinarian, so each pet is also so much important to that owner. So there also we need to investigate. Okay, and we should have developed that kind of genetic laboratories in our colleges also in a clinical section. So we should not consider genetic subject as a only animal husbandry subject. It is also contributing a lot. And throughout the world, the labs are there. So India, we have lab in NDT. So through exclusive breed health canine tests are there. These tests are not much done in the India, and so we can. But here there are some agencies who can export those, outsource those things. Otherwise, we can develop in India also remaining things in pets also. Okay. So this is the laboratory which I have developed in Mumbai through RKVR funding, and we have given this services to the field. But now because of manpower required less and all, we are not able to maintain. So this public-private association can spend the need. Tissue culture lab, so we have established this kind of. There we have Dr. A.K. Mishra, our Vice Chancellor, same cell culture with Dr. Rahul's experience from that road. Okay. So this clean room and all we have Dr. A.K. Mishra. Then this laboratory we have established that processing committee for students. This is ASEAN committee, our committee visited and appreciated that.
whatever the veterinary graduate, EGR, PhD, especially in genetics, they can explore this work and they get benefit. Thank you.